Welcome to Healthy Conversations, where we share stories and insights from the people who help make a difference in the health of our community. I'm Susan Claiborne, joined by community hosts Kim and Laren. Pregnancy is such an exciting time, but it can also bring a lot of questions, and that's okay, because today we're talking with Dr. Noel, OBGYN with Valley Women's Center, about how moms to be can build a strong partnership with their provider throughout pregnancy. So, Dr. Noel, thank you so much for being here today. I know it's hard to get out of the office. Patients always come first, but we appreciate you making time for us. So, let's just start with you just telling us a little bit about yourself, kind of how you came into working in OB and even coming to our area, because I know you're still relatively new and coming back, maybe what, a year and a half?
A year.
Okay.
Started working a year. Yeah, a full year about.
Awesome. We're so glad to have you. So, yeah, tell us more about you.
My name is Joada Noel. I was born in Haiti. I moved to Florida in 2005, so it's been 20 years. I went into OB just because I feel like women's health is very important and very dear to me, just because of personal experiences. And I feel like I can reach out to many women that have been through trauma or just having questions about growing up, how to clean themselves, basic questions actually. And I feel like I could be an aid in that field. I went to school at St. George's University on the beautiful island of Grenada. I trained in New Jersey. I was there for 6 years total, 4 years residency, 2 years finishing school. And I've moved to Athens. Um, how I ended up here, my husband works at Decatur. He's an aerospace engineer, and he's been here, and I found myself following him, and it's been a pleasure. I started working at Valley Women in January of this year. Also, very great staff, very great patients. The patients are awesome. The staff is great. The hospital is great. So I'm having a great time, and I can't wait to continue and to continue working with everybody.
Well, we are so glad that to have you here. And I know I see the Google reviews, so your patients are loving you for sure. So we do love having you here. So, in talking about pregnancy and things, I know one of the most important parts of prenatal care is building a good relationship with your provider. So, kind of tell us, what does that partnership look like for you from your perspective as an OB?
I think it's very important for patients and doctors to have a good relationship built on trust, communication, building a good rapport, especially you're not only caring for yourself, you're caring for a little one that for a big portion of it, you don't know is in your belly for a little bit, for a little while until they start moving. So it's important to have that relationship with your doctor, to ask all the questions, to be open, and for your doctor to listen and answer the questions to the best of their abilities and to make you feel cared for throughout the whole process.
Well, and I know new moms can sometimes be extremely uh, nervous to ask questions. So, what would you say to kind of reassure them that no question is too small and no question is too dumb, because, our bodies are changing. And so we can have a lot of questions and we hear a lot of different things.
Throughout even the first visit, the first prenatal care visit, throughout the visits, I make a point to just kind of ask them, after saying a whole lot of information, I stop and I ask them questions. I usually tell them, reassure them, just ask questions. The best you can do is ask questions. You can get information from the internet, get information from your family, but at the end of the day, asking me questions and I'll do my best to answer you to the best of my abilities. I just have an open door policy. We're smiling all the time. I come in, sometimes I forget to introduce myself because I'm just so excited to see them. And then I have to take it back a little bit. So it's just an open floor. I think with my patients, at least, I hope they feel like they can ask me anything at any time.
What do you think are some of the key questions for expectant moms to ask in those early prenatal visits?
Um, what they can eat, sleeping, medications for nausea or medications to take or not to take, task if they're able to perform certain tasks still. Because some people feel like maybe they should stop lifting things, and of course we talk about restrictions if there is any or need to be any. So And if they're not able to ask all those questions in the first visits, I tell them go home, take a breather, because the first visit is excited. Your brain might not work as well. So go home, write everything that you have down, come back to the next visit with as many questions as you can.
Well, I know that lifting question was a scary question for me when I first got pregnant because I found out I was pregnant like a week after we had cleaned out a warehouse. And so I had been lifting boxes over and over and over again. So when I found out I was pregnant, that was the first thing I thought of was, oh no, have I just messed up? So I can see that. I can see that.
And we have a lot of working moms. So they'll, depending on where they're working, what they do for a living, lifting is a thing. Environmental questions is another. I've encountered that quite a bit. So we talk about jobs, food, um, what they do at home, and certain tasks they can or cannot perform. So
Yeah.
yeah, that's pretty much
I can
it.
see that.
Okay, pregnancy brings so many changes, physically and emotionally. What are some common concerns or topics you discuss with your patients as they progress through each trimester?
Let's say first trimester, the biggie is morning sickness
Okay.
and fatigue. They bring those questions all the time. And being a new mom myself and having experienced pregnancy myself, first trimester, thankfully I was not working, but I was very confused as to what my body was going through. And being an OB, I've never done this before myself, so it was very new for me going through the process. So fatigue is very common. You would wake up in the morning and the day gone by and you have no idea how the day managed to go by so quickly. You're just kind of a lump. And it's okay. Your body is working overtime. You're building a human from scratch. So it's okay to be fatigued. It's normal. Just make sure you eat as much as you can. But um, second trimester, we discuss a lot of around ligament pain, some back pain, what you can do for those different conditions or different things you might be experiencing, like wearing a belly band, for example. Um, and that second trimester is a honeymoon phase, is the is the best period. Kind of you start feeling baby move. Your belly's not too big just yet, so you're just in the sweet spot. And then third trimester, we talk about sleeping positions. We talk about, of course, the labor process, what to expect, maybe some preterm contractions or preterm labor, what to expect, what to not expect, or when to go to the hospital, um, labor and delivery in general, pain management, and all those things.
That sleeping position is extremely important. They come out with all those pillows and things like that because you don't realize when you can't sleep how miserable you feel. I mean, you're already big, you're already miserable from that. But when you can't sleep on top of that, I know some people say, the old grandparents and things would say, "Oh, that's just getting your body ready to stay up all night with the kids." And I'd be like, "No, I need my sleep now."
Yes. I was trying to tell myself the same thing, but at the same time, I'm like, I would prefer sleeping now and then just going head on postpartum.
Yeah.
And also 28 weeks is when you start telling patients not sleep on their backs because the weight of the pregnancy can affect blood flow, can lead to dizziness and everything. So it's definitely a biggie, sleeping position in the third.
Do you have any tricks of the trade for nausea that's not prescription?
Um, Ginger products,
Okay.
ginger tea, ginger chews, ginger ale. There is a band, the motion
Seasick
sickness,
one?
the seasick one you can wear, eating sour candy, because a lot of the nausea is not necessarily because you're nauseous, it's your brain kind of, it's like a hormonal thing. So sometimes you can trick your body out of the nausea by eating sour candy. Um, that's
I lived on lemon heads. I love lemon heads.
like it just kind of reprogram your mind a little bit in your body.
How can patients prepare for discussions with you about birth plans, pain management, delivery options? How is that an open conversation with you?
It starts with prenatal visits. That's the most important thing. After the first prenatal visit, I do ask them if they have questions because sometimes you see that they want to ask questions and they're not able to really bring it up. So I tell them, let the time settle, go home, enjoy the news of the pregnancy, write every questions you have down, and then we'll discuss them at the next visit. If I'm not able to answer something, I don't necessarily tell them to go to the internet. For example, pain management. There are some patients that want to do this naturally, and it's perfectly fine. But I do advise sometimes to watch what a real labor is. If they've never experienced it themselves or have a friend, watch a delivery and see how essentially painful it can be, but at the same time try to find ways to educate yourself on pain management for yourself. Like, how can you handle this pain? Are you able to handle this pain? But it's never too late to ask for an epidural. There's IV pain medication that we talk about, and then eventually the epidural. You can have an epidural whenever, as far as when you're in my care.
Is there a point where there so I didn't realize there wasn't a I thought there was a point where you couldn't get an epidural.
There's not necessarily a point where you can't, although it might depend on the anesthesiologist.
Gotcha.
So when the pain is excruciating and you can no longer tolerate the contractions, you're no longer able to sit straight, it might become more difficult and you might not be able to get one.
Right.
So I don't tell the patients, oh, when you're 8 centimeters to get one if they want to keep pushing. We have the conversation as when you get to a point where you feel like the contractions are starting to become unbearable and you feel like you won't be able to sit straight, then I would consider getting an epidural at that time before it gets to the point where you just can't anymore.
Sit still to
Can't
get
sit
an
still.
actual epidural.
And you have to sit still with your back curve and not move and be able to breathe through your contractions. So if you get to a point where you can no longer do that, then they might not be able to give you an epidural.
But there's not a hard line, not a hard cutoff.
No.
I don't guess I realized that. So when is a good time to introduce a birth plan? At what trimester, or what point, what week do you start talking about birth plans?
I bring up delivery sometimes first visit just to kind of put it in the back of their mind what the process might be, what an induction would be, when it might be introduced. For example, if everything's going well and healthy in the pregnancy, we might talk about an elective induction at 39 weeks. But if your body don't go into labor by 41, then we would consider talking about an induction at that point because can be a safety issue. But granted, it's up to the patient. It's a conversation. It's a recommendation. Um, and at the end of the day, it's your body, it's your baby. But we just want what's the safest for a healthy mom and a healthy baby at the end of the day.
I know, like in my case, I had a large baby the first time. So, the second time, everybody would always say, you have a larger baby the second time. I don't know statistically if that's true, but for me, I kind of wanted to have that 39-week induction because I kind of didn't want to risk having
A larger baby.
a larger baby. And that was my personal choice that I spoke with my doctor at the time. So,
Do you ever have any women opt for C-sections from the beginning? Can you do that? That's an option just
Yeah.
to say,
Sure.
I'm scared, I want to plan it this day and I want a C-section.
We talk about it. We explain the risk of the C-section. We bring up the fact that having multiple surgeries after the first C-section bring risk. So it depends on the family size, your goal for a family size. So it can kind of limit the amount. If you want 10 children, then having a C-section right away might be a little difficult and kind of stopping that number by 3 or 4.
and that makes sense. That's
But
understandable.
if a primary C-section is what you decide, we just discuss the risk. And as long as you understand what you're going up for, it's your decision at the end of the day.
Dr. Noel, the pregnancy journey usually includes a whole team. Lots of folks from nurses to techs, phlebotomists, lactation consultants. Can you talk about how you and your team at Valley Women's Center and the hospital work together to provide that wraparound care during the pregnancy?
Yes. So in the office, the medical assistants are one of the first people the patients interact with. I think it's very important to have a welcoming team, and I think our team at Valley Women is very welcoming, put the patients at ease. As far as the ultrasound techs, the same. They get to tell you sometimes the sex of the baby, or they get to help you hear that first heartbeat, measure the baby, tell you how many weeks, your due date. So it's a very welcoming team. And the phlebotomist, also very important, although now they have moved down this a few doors down from our office, but it's still a comprehensive care. I think everyone that we work with are very nice and welcoming. As far as the hospital, similar situation. The nurses are at bedside more than the doctors are. That's the given. But the nurses definitely provide the emotional support, that bedside care, bedside manners. I think overall we do our best for the patients, and we come with a smiley face and give the patient that care and make them feel at ease overall. And I think the whole team participates in doing that.
Yes, I can attest to that personally. Both of my daughters, I saw OBs at Valley Women's Center. I delivered both at ALH and had just the most phenomenal experience. But I was also a mom that had a high risk pregnancy the first time, and some complications the second time. And, I loved seeing how the team at the time was able to keep that in mind as they were taking care of us. Can you talk about that and kind of what you guys do to make sure that mom and baby are safe when you're dealing with those high risk situations? Sorry, I'm choking up.
Um, so we assess, of course, through prenatal care. I tell the patients, we talk about the timeline from day one. And of course, if something comes up throughout the pregnancy, we talk about the possibility of sending them to Huntsville, which is where we send most of our patients. Sometimes we send to UAB or Tennessee if we have to. But if anything rises like preeclampsia or diabetes, or if they come in the pregnancy with type 2 or type 1 diabetes, we get MFM, maternal fetal medicine, involved right away, and we kind of co-manage. So we'll take care of the obstetric, the day-to-day, the week-to-week, but we do send them to the high-risk physicians to kind of care for the baby a little bit deeper than or pet specialty allow us to. So they'll see, for example, they'll do growth ultrasounds every 3 weeks, or they just have that more in-depth care with MFM, but they see us weekly, and a lot of times we get to deliver their baby still. So we still very much are all involved in their care, and they send us their records, we send them our records, and we co-manage the patients that way for the high risk. And of course, if complication arises at the hospital, is a conversation. Labor is very fluent, I would say. It's not a straight line. Every baby have their own way of coming out or of delivering themselves sometimes. But most people go into the hospital expecting a vaginal delivery. That's the conversation a lot of time we have in the office, and that's the plan. But again, delivery can happen anyway. At the end of the day is safe mom, safe baby. So if a complication were to arise where, for example, you need a C-section, it's a conversation. We try to talk to the patient. Sometimes it's very fast because we have to act fast, but right after everything settles, baby's out, C-section is done, or complication is averted, we'll talk to the patients and kind of explain what happened to just kind of fill them in a little bit more and make them feel at ease, especially for the next pregnancy whenever that comes.
I think every mom has, well, we know every mom has their pregnancy story. Kinda off camera before we were getting started, we were kind of all talking about ours, and it's amazing how unique everybody's delivery story is. Um, and so I can't imagine all the different ones that you have experienced. Um, and I think, a lot of women have a preconceived idea because they have a birth plan, which is fabulous. Um, but kinda speak to just the fact of having to kinda trust their bodies and kind of having to trust their providers for that ultimate delivery end that nobody can truly predict.
A birth plan, I think, sometimes is important. But I think everyone should be a little open to the different versions of labor. It's not, again, like I mentioned before, it's not a straight line. So If, for example, you come to the hospital and you want to do it all natural, I've had patients say, don't bring up pain medication. I'll ask for it when I ask for it if I want it and things like that. I think that's important as long as you, to a certain extent, know that it's not limited to you. The option is there. And whenever that time comes for you, we're here to receive, um, to help you and to guide you through whatever you have decided. Every baby have their own birth journey. So I know it sometimes feel a little down if you come in wanting a vaginal delivery, having a birth plan, wanting all these things to go in a certain order and things don't go that way. It is okay. It is okay because safety's first. You want a healthy baby. You want to be healthy yourself for your baby. So I hope through the process you're able to trust your provider, and trust that the provider has your very good intention for you and want the same outcome you want for yourself.
Yeah. I agree. Well, I appreciate you being here to kind of share that. And pregnancy is a little scary. It's exciting, but it's scary. And of course, any of us probably remember those last few weeks, you're ready for that baby to get here and you're walking and it's heavy and you're anxious and
Waddling.
I
don't know about walking.
and every morning you open your eyes, you go, God, I did not go into labor last night, because you're
Today.
maybe today. So, but we so appreciate what you do and having Valley Women's Center here in our community and such great providers too that work with the hospital and the baby place, to bring all these little babies into the world right here in Limestone County. So thank you for being here.
It's a pleasure. Thank you for having me.
Thank you, Dr. Noel, for sharing your insight and experience and reminding us how important it is for every mom-to-be to feel seen, heard, and supported through her pregnancy. To our listeners, remember pregnancy is a partnership. Ask questions, stay informed, and trust your team at Valley Women's Center and Athens Limestone Hospital. We're here to provide compassionate, expert care for every stage of your journey. I'm Susan Claiborne, and this has been Healthy Conversations. Thank you for joining us, and until next time, keep having healthy conversations.